Bismillahirrahmanirrahim. Assalamu alaikum. I am Ribka Sabahat, a clinical coordinator at University of Lahore. Today, the topic I am going to discuss is nutritional approaches in metabolic syndrome management. First, we will discuss a case study. Amir is a 48-year-old man who is diagnosed with diabetes mellitus 2. He also has high blood pressure and is taking medication for it. He has a BMI of 34.17 kilogram per meter square and falls in the category of obese grade 1. He has high level of triglycerides, that is 160 mg per deciliter, suggests medical nutrition therapy for him. As it is shown that Amir has different metabolic conditions that are result of alteration in the metabolism. This cluster of diseases or conditions is known as metabolic syndrome. First, we will discuss the difference between syndrome and a disease. A syndrome is a complex of symptoms and findings that result in a specific condition, but the direct cause of that condition is not known. However, in case of a disease, the cause or the process through which the disease is caused is known. The definition of metabolic syndrome that is provided to us by the International Diabetes Federation have 5 factors. Number 1 is the waist circumference greater than 94 centimeter in men and greater than 80 centimeter in women. Blood glucose level greater than 100 mg per deciliter, HDL cholesterol level lower than 40 mg per deciliter in men and lower than 50 mg per deciliter in women, blood triglyceride greater than 150 mg per deciliter, and blood pressure greater than 130 by 85 millimeter of mercury. If a person has 3 or more of these factors, then he is considered a patient of metabolic syndrome. Then comes the factors of metabolic syndrome that were discussed previously. These are summarized as the metabolic syndrome patient will have visceral obesity, insulin resistance, hypertension, high triglyceride, and low HDL cholesterol. The term metabolic syndrome. In the past 20 years, this clustering of metabolic risk factors was known by different names. Insulin resistance syndrome, syndrome X, the deadly portrait, or hypertriglyceridemic waist. However, today the term most commonly used in the clinical practice is metabolic syndrome. In Pakistan, the prevalence of metabolic syndrome is 18 to 46%. However, throughout the world, 31.4% male, 27% female, and 30 to 50% overweight children and adolescents suffer from metabolic syndrome. Metabolic syndrome can increase the risk of different diseases or chronic conditions, such as in case of atherosclerotic cardiovascular disease, metabolic syndrome increases its risk by 1.5 to 3 folds, as well increases the risk of cardiovascular event and death by 1.7 folds. Primordial prevention. Primordial prevention is a term that was proposed by Stresser in 1978 and is approved by American Heart Association. Primordial prevention is an ideal condition that, when obtained, is capable of increasing the lifespan of a person by 10 years. Then we will discuss the nutritional intervention for patients of metabolic syndrome. Firstly, we will discuss proteins and amino acid. Proteins help in weight management by increasing thermogenesis and metabolic rate and inducing satiety. That is, the person having a meal rich in proteins will have lower hunger or will consume lower amount of food later on. Then comes the fiber, which are of 2 types, soluble and insoluble fibers. Soluble fibers will result in lowering the glycemic index and gastric emptying time. However, insoluble fibers will increase the gut transit time and decrease insulin resistance. Both of them combined will result in low weight gain, increasing bulking effect and satiety, will regulate various gut hormones and decrease inflammation. When we discuss fatty acids, it is found that saturated and trans fatty acids have deleterious effect on metabolic health. In contrast, unsaturated fatty acids that include monounsaturated fatty acids and omega-3 and omega-6 polyunsaturated fatty acids improves metabolic parameters. These are the sources of omega-3 fatty acids. In animals, fatty fish, and in plants, basil, chia seeds, hemp seeds, and flax seeds, etc., are high sources of omega-3 fatty acids. Different components of our diet will have favorable and unfavorable influence on the parameters of metabolic syndrome. For example, protein and fiber will have favorable influence on obesity. However, saturated and trans fatty acids and sugar sweetened beverages will have unfavorable influence on obesity. Resveratrol and stenol will improve dyslipidemia. However, saturated and trans fatty acids will worsen dyslipidemia. Magnesium and potassium will have favorable influence on hypertension. However, sodium-containing foods will worsen hypertension. Same is the case with insulin resistance, that fiber and blueberries will have positive influence on insulin resistance. However, saturated and trans fats and sugar-sweetened beverages will worsen insulin resistance. Next, we will discuss some dietary strategies and their potential benefits on metabolic syndrome patients. The first dietary pattern that we will discuss is the Mediterranean diet. Mediterranean diet provides 35 to 45% of calories from fat, 35 to 45% of calories from carbohydrate, and 15 to 18% of calories from protein, and it results in reduction of CVD incidence and blood pressure, as well as decreased incidence of diabetes, and is mostly associated with mortality. DASH diet provides 27% calories from total fat, among which saturated fats are restricted to 6%. DASH diet provides 5% calories from carbohydrate and 18% calories from proteins. It will result in reduction of blood pressure, BMI, and waist circumference, as well as reduction in diabetes mellitus incidence, and improves cardiometabolic profile. Next comes the plant-based diet that reduces the animal-derived foods and is high in plant-based foods as well as unsaturated fatty acids. It results in reduction of blood pressure, body weight, and risk of obesity, as well as cardiovascular disease and type 2 diabetes mellitus. High protein diet, as the name suggests, that the diet is high in protein. That is 20 to 30% of calories are obtained from protein, and is low in carbohydrate. 40 to 50% of calories are provided from carbohydrates. It results in decreased body weight and risk of obesity. Next, we will discuss the role of functional foods in improving metabolic syndrome. Phytochemicals. So basically, what are phytochemicals? They are the non-food and non-nutritive components that are present in a plant-based diet and have positive or disease-preventing effects. They are associated with protection or treatment of chronic diseases such as cancer, heart disease, hypertension, diabetes, and other conditions. Following are the bioactive components that have beneficial or positive effect on the parameters of metabolic syndrome. So cumin is a bioactive component of turmeric, have anti-inflammatory and antioxidant effects, and increases insulin sensitivity. Allicin is the bioactive component of garlic, has anti-inflammatory and antioxidant effect, increases insulin sensitivity, and decreases total cholesterol. Polyphenols is found in cinnamon and has anti-inflammatory effect, increases insulin sensitivity, as well as improve fasting blood glucose. Polyunsaturated fatty acids are present in fish oils, and they decrease lipogenesis and increase fatty acid oxidation. Then comes a theory that is known as developmental origin of health and disease. It demonstrates that a person, the nutrition is in early life of a person is associated with metabolic syndrome, obesity, and diabetes risk or occurrence in later in adulthood. For instance, if an infant is born with low birth weight, he will have low adulthood muscle mass, and consequently the risk of diabetes, metabolic syndrome, and cardiovascular diseases will increase. In addition, if a child suffered from infection or growth restriction, it may contribute to metabolic and cardiovascular disease later in life. Moreover, overconsumption of high-calorie beverages during infancy will result in childhood obesity, and addition of salt during infancy may result in hypertension later in life. The last topic that we are going to discuss today is physical activity and its association with metabolic syndrome. Whenever we suggest a medical nutrition therapy to a disease patient, physical activity is a significant part of medical nutrition therapy. In case of metabolic syndrome, its significance is very large or very high, because physical activity reduces almost all of the parameters of metabolic syndrome. Increasing evidence suggests that excessive sitting and television viewing time will result in increase in the risk factor of cardiovascular diseases, which include weight gain, obesity, dyslipidemia, hypertension, and insulin resistance. Epidemiological studies also suggest that people who are involved in regular physical activity, they have low occurrence of type 2 diabetes mellitus, cardiovascular disease, and premature mortality. Walking is the most common form of physical activity. It improves health in many ways and is generally safe and recommended. These are the references from which the slides have been made. Thank you.